thank you for doing this. I appreciate it.
I thank for the opportunity.
Absolutely, absolutely. So Dr. Touliatos, it's great to meet you. I've heard a lot of
Likewise,
interesting things
I've
about
been
you.
watching you, and thank you for the opportunity you gave me.
Absolutely, man. So for our viewers, I want to give them a little background about you. Maybe you can just tell me, sort of like, because your nickname is Dr. Testosterone, right? That's what they call
Yeah,
you?
Dr. T, as my surname implies, it starts from T and testosterone. And that's how it started with the anabolics 2017. So Bill Welling called me Dr. T because it's easier to pronounce my Greek name. Anyway, I'm 47 years old, and I started bodybuilding, competitive bodybuilding at the age of 26. Soon after, I graduated from Medical School of Athens at age of 25. But my passion was about athletics. However, I come from a conservative medical family, and I had to follow the medical tradition. The point is, I was really good in sports from Athens College, and I was collecting trophies in sports, in track athletics mainly, so sprinting and long jump that actually interferes fast muscle fibers like bodybuilding. So kind of I was genetically for bodybuilding and sprinting because of my fast twitch white muscle fibers. Anyway, so soon after I graduated from medical school, I had already tried supplements at the age of 24. So nearby, I was about to finish my med school, and I had no idea about PEDs. So at the age of 26, I moved to an island in west side of Greece in order to practice because every GP has to practice in the villages in the country. So it was meant to meet my first mentor, who's now 50 plus years old. And he was a guru. He was a kind of bro sounds. He tried everything, but he was reading already the muscle media, the anabolic handbook of Dan Duchaine. He was really educated. So the fact that I was a passionate doctor and I wanted to experiment myself gave him the opportunity to talk with me. Of course, I was paying for that. And also I had the opportunity to make labs to myself as I was working in the hospital. So I was rushing into the toilet. I was taking blood for myself while I was using steroids. And afterwards, I was analyzing this blood to the public hospital and see how things would fluctuate as I was using testosterone, primobolan, pharmaceutical grade companies. And later, as I was preparing for 1 year and a half, I wanted to test myself how I'm doing to compete myself, to compete along with the best in the national level. So I had this kind of competitive spirit from the early ages of my school time as I was doing track athletics. So I started doing the fitness competition in 2000 at the age of 26. So I started with fitness. The first three competitions. The first one I was out of six, and the second one I managed to win in a Grand Prix. The third one I managed to win in the nationals, and afterwards I moved to the bodybuilding. So within 2000, I did my first four contests, and between the 2000 and 2009 was a huge gap in order to do my residency. Now during my residency, I was training. I was using a little bit of gear, but nothing special. But of course, I couldn't take part in shows and in competitions. And afterwards, I had a small break from the first part of my residency. And 2009 and 2010, I was able to compete again. And finally, as I fulfilled my obligations with the residency at the age of 40, I retired at the Masters. So 2013 ends my athletic career. And by the way, it was just about to finish my residency. So 2014, I started practicing as a doctor. And my dream was to become one day the doctor of the bodybuilding community. So I was preaching what I was walking the talk. I was not just a theoretical doctor talking about steroids. I had tried them to myself, and afterwards I wanted to basically do what Thomas O'Connor does. So talk about prevention. There are many doctors who are prejudiced and skeptical and just demonize about steroids. The point is, this is so easy. The point is, can you help somebody that is determined to go in this pathway? And of course, this needs some theoretical experience, which is hard earned, and also, of course, going by the book. But just going by the book misses half of the truth. Of course, bro science is another field that does not include scientific data. So getting together these things is the best combination, experience along with education. So yeah.
So, as far as you being a doctor right now, what kind of doctor are you specifically?
So
Are you...
I'm a biopathologist. That means I analyze bodily fluids like, of course, blood, urine, saliva, cerebrospinal fluid, vaginal fluid, semen, whatever. But mainly I focus on the blood of people who use or abuse PEDs, okay? And my role is how to prevent the side effects in the biochemical labs. And another thing is that since I retired, I faced the anabolic steroid-induced hypogonadism, which actually is a late onset hypogonadism for those men who abuse steroids on and off for quite so many decades. Therefore, I had to go to start using TRT, So I also suggest and advise and consult doctors and also patients who want to getting into andropause, but they want to do anti-aging or replacement therapy because they no longer produce testosterone.
Right. So I think in order for people to be clear what we're talking about, right? There's two types of PED use, right? Or steroid use. One is for let's say if you low level, to bring your natural levels to the healthy levels. And that's something that in the United States a doctor can prescribe. It's legal, right? It's a certain amount of dosages that's involved in that. Now, the different use is for bodybuilding purposes or for actual performance purposes, right? And that's considered to be illegal, and the dosages are much, much, much higher than what a doctor can ever legally prescribe. So when we're talking about steroid use, do you condone, how do you look at the one specifically for bodybuilding purposes, where in the United States you can't legally prescribe those amounts? You know what I mean?
Yes.
So how do you condone it, or do you look down on it?
I neither listen. I have written three Greek books and 3 English books. So in my books, if you read them, the final conclusion is I neither demonize or give a blessing. I just support education and information. Okay, so knowledge mainly. So in case somebody is determined to go into the pathway as an adult, then he has to judge the pros and the cons and decide. However, you have to know in the first place what are the potential side effects, okay, in order to do this more safely, because you know that only the healthy athlete supports the system. If you're not healthy, you don't support the supplement store, the gym, the personal trainer, the nutritionist, everything. So health is the most important parameter in order to be healthy and have consistency.
Mm-hmm. Now, is it true? I mean, like in the media, usually steroids are looked upon as something very taboo, very, very dangerous, and it's basically a negative thing, primarily for the majority of people. Do you agree or disagree?
Yes and no. Listen, even testosterone, which is the most natural compound and hormone that is released from the body, is demonized by the doctors. Why? Because we bodybuilders gave it a bad name throughout the abuse. Now, you cannot live testosterone under deficiency, like women cannot live without estrogens under menopause. So under optimization, that means 100 or 150 or even 200 lean physically. But if you abuse, have the plethora of the side effects. So under optimization, AAS. Now, anabolic androgenic steroids, they were manufactured for certain diseases: osteopenia, anemia, muscle wasting, burns. So in case you apply small doses, like for instance, 50 milligrams of nandrolone, and not instead of 500 milligrams per week of nandrolone, then you're gonna treat those symptoms, and you're not gonna have these side effects, okay? The point is, frankly, who's gonna use 10 milligrams of Anavar per day, or 50 milligrams of Deca per week, or 100 milligrams of testosterone per week? So this is about treating, but not having performance enhancing purposes and effects.
But is it safe to assume that all professional level bodybuilders in today's bodybuilding, society are abusing it? the dosages?
That's their job, you know. They make the living. They make the living. So they need also a certified doctor and open-minded, of course, to help them do it more safely, you know. Because if there's somebody who wants to compete on the Olympics says, I have to use 50 pills out of the drug, and the doctor says, no, you have to use 10. But the point is, I want striated glutes and really hard to the rear, you know. He might lose the show and the hundreds of thousands of dollars that he's going to win. The point is, the doctor has to help him afterwards to clean out the process, you know.
Sure. Now, what about your personal? Can you tell me about your personal experience with using steroids? Did you encounter a lot of
Yes,
side effects?
yes. I have done also a very strict personal criticism. Now, I started from the age of 26, and officially I retired at the age of 40. And seriously, after I started TRT, I haven't done any serious cycles. So I've tried every kind of steroid as I was an athlete, with the exceptions of methyltrenol M3. I never tried this drug. So I recently now started using low doses of GH as age management, you know. And I have not vast experience with insulin or IGF-1. I tried a little bit, but not, you know, progressively. And I had, yes, of course, I had side effects that they were reversible and non-reversible. Now, the non-reversible are the TRT, the andropause, and the suppression of the HPTA, that I no longer produce testosterone, that I have to administer myself every week testosterone, okay, for the rest of my life. Actually, this is what ADHD done also. But the point is, I had also pharmaceutical hepatitis. I had left ventricular hypertrophy. I had dyslipidemia. Sometimes I had excessive roid rates. This is something, you know, it's personal. It's about your temper also.